Hello, and thank you for taking a moment to check out this video from Colorado Prosper. My name is Michelle Sarche, and I'm a member of the Colorado Prosper Health Access Team. I'm a professor at the University of Nebraska Medical Center and a tribal citizen of the Lakota Band of Ojibwe tribe. I'm trained as a clinical psychologist and have worked to support maternal and child health within tribal nations and communities for nearly 30 years. In this video, I'm going to share more about the maternal and child health care gaps that Colorado Prosper is designed to address. As Celeste and Shalita shared in the first video of this series, Colorado Prosper was designed to increase access to mental health and substance use care for pregnant women or those parenting infants. Access to mental health and substance use care in the perinatal period is critical. The Colorado Department of Public Health and Environment identifies perinatal behavioral health as a persistent concern and notes that behavioral health issues are the leading cause of maternal mortality in Colorado. According to a 2023 legislative report, suicide and unintentional drug overdose each accounted for 1/3 of pregnancy-associated deaths and were its two leading causes. Colorado's 2023 Pregnancy Risk Assessment and Monitoring Survey, or PRAMS, data highlight the extent of mental health and substance use concerns faced by Colorado women during the perinatal period. According to these data, during the postpartum period, about 1 in 5 women were told by a provider they had anxiety. 1 in 6 were told they had depression, and nearly 1 in 5 were prescribed medication for depression or anxiety. Over 1/3 of women reported using alcohol at least once during pregnancy, and 1/4 reported having 2 or more drinks within 2 hours at least once during pregnancy. Other substance use during pregnancy was also reported by women, including 8% who reported using marijuana at least once during pregnancy, 8% who reported using it at least once since their baby was born, and about 3% who reported smoking, vaping, or using e-cigarettes in the last 3 months of pregnancy. PRAMS data also highlight the extent of psychosocial stressors experienced by women during the perinatal period. According to PRAMS data, almost half of women reported at least one serious stressor in the 12 months before delivery, while 1 in 10 reported experiencing 3 or more, including separation or divorce, housing insecurity, financial strain, their own or their partner's incarceration, someone close to them having a problem with drinking or drugs, or someone close to them being very sick or dying. PRAMS data also revealed that 1 in 5 women experienced food insecurity in the 12 months before delivery. Colorado Healthy Moms survey data highlight another kind of stressor among women in the perinatal period, and that is the experience of childhood abuse, neglect, or family hardship, which was reported by 1 in 6 women. While the need for perinatal mental health and substance use care is critical for all women, the need is especially great among certain groups. According to the legislative report referenced earlier, the rate of pregnancy-related and associated deaths is highest among perinatal women living in frontier areas of the state, who are on Medicaid, who have a high school education or less, who are more than 40 years old, or who are American Indian, Alaska Native, or African American. Considering that mental health and substance use are the two leading contributors to maternal mortality, particular attention should be paid to these issues among these groups. The data I've just shared highlight the importance of access to mental health and substance use care during the perinatal period. However, access can be limited for a number of reasons, including whether perinatal mental health or substance use services are available at all in different Colorado communities or regions, whether available services are aligned with patients' language preferences or their cultural, spiritual, or personal beliefs and practices, whether patients trust available services or have experienced discrimination, whether patients have insurance or the ability to pay, and whether patients have transportation to get to available services. According to U.S. Department of Health and Human Services data shared by the Colorado Department of Public Health and Environment, all Colorado counties but one are considered a mental health profession shortage area. This includes 9 counties in southeast Colorado with severe shortages and 8 counties in the Denver metro area with a shortage of providers for low-income populations in particular. In addition to the mental health profession shortage in Colorado, 40% of Colorado counties are considered maternal health care deserts that lack a birth center, a hospital offering obstetric care, or any obstetric care providers, according to a report by the Regional Economic Development Institute at Colorado State University. Together, these data raise concerns about perinatal mental health care in Colorado. A 2025 Colorado Perinatal Care Quality Collaborative report underscores these concerns, finding low rates of perinatal mental health care use, especially during the prenatal period, and finding that 80% of individuals with a prenatal mental health diagnosis and 66% with a postnatal diagnosis received no mental health services. Together, the data I've shared here highlight the need for a program like Prosper, which helps providers increase their perinatal patients' access to mental health and substance use care. In the next video, about how Prosper can help providers close care gaps for perinatal patients through navigation and timely referrals responsive to each patient's needs.